Hi, my name is Ruth Villalobos and we are the group number 5. We are going to talk about the COVID-19 vaccines. So, I'm going to make a question and also I'm going to answer it. Okay, so are COVID-19 vaccines safe? Vaccine safety is always one of the highest priorities, and this is not different for COVID-19 vaccines. All vaccines go through clinical study phases before they can be approved for use in the population. These tests are intended to ensure the safety and availability to the vaccine to protect against the disease efficacy. Vaccines being developed against COVID-19 are following these same phases and will only be approved or introduced in the countries for use in the general population once its safety has been demonstrated in the face of regulatory authorities. Likewise, who will only authorize their inclusions in the list for use in emergencies when you have analyzed in all the test data. And once COVID-19 vaccines are approved, safety tracking keep going. This follow-up is common component of training programs immunization and is done with all vaccines.
Hello, my name is Maria Vigil. I will talk to you about COVID-19 vaccine. COVID-19 vaccines are efficient COVID-19 vaccine that have been approved for use in some countries have been evaluated in clinical trials, which have provided information on how effective they are in preventing the disease. National regulatory bodies analyze this data for authorization that effectiveness of vaccines continues to be closely monitored even after they have been introduced into country. Only those vaccines have been shown to be effective in preventing the disease are prone for use in the population. I think it is important to get vaccines. Fortunately, we live in a corrupt country where vaccines are stolen, and many people they die daily. Thank you for attention. Goodbye.
Hi everyone, my name is Sara Salinas and today I will talk you about COVID-19 vaccines. What vaccines have been approved and where? As of March of 2021, there are several COVID-19 vaccines licensed for use by some national regulatory authority. In addition, WHO has also licensed two vaccines from Pfizer, BioNTech, to two versions of AstraZeneca Oxford, SK Bio and the Serum Institute of India, and the Janssen vaccine. How will people be able to access COVID-19 vaccines? When COVID-19 vaccines are available in every country in the world, people will be able to access through their country's immunization programs.
Hello, my name is Fernanda Yuset Colendres Salinas. Today I speak for the how mRNA vaccine work are now. Okay. mRNA vaccines instruct the body to produce a small part of the virus, which causes a reactive if an immune system to protect you. These vaccines are new but unheard of. Researchers have been studying and working with them for decades to fight to flu and sick. Okay. It is better to get COVID-19 naturally than to get vaccinated against this disease. No. The vaccine will create immunity without the harmful effects associated with COVID, including long-term effects and death, allowing the disease to spread to herd immunity could cause millions of deaths and even more people with the long-term effect of the disease.
When will the vaccine against COVID-19 be able in my country? Although some countries in our region have authorized certain vaccine as an emergency, vaccine against COVID-19 are not yet available in many countries. The OPS encourages the population to follow and the information provided by their national health authorities to determine when vaccine against COVID-19 will be able in each country. What vaccine should I get? Which is better? And the OPS allows people to be vaccinated against COVID-19 with any vaccine offered by the health authorities when you meet the established criteria.
Hello, my name is Ricardo Murillo from Group of 5. I will talk to you about vaccine COVID-19. How long does the immunity generated by the COVID-19 vaccine last? As of January 2021, there are still many unknowns about most of the exported vaccines against COVID-19. There are underdeveloped of the vaccine licensed or for use in emergency. We still don't know how long the protection they promise lags. We will have the answer to this and other questions in the coming months, as vaccines are studied further. Will you have to take vaccine every year against COVID-19? Today, research continues to determine the duration of immunity. That is general after vaccination against COVID-19. With correct vaccine in addition, the protection of this vaccine against the new variants of SARS continues to evaluate. We will have the answer to this and other questions as we have more studies in the patient population, which will allow us to determine where it will be necessary to carry out annual vaccination or are different periods.
Hi, my name is Joshua Alexandre Cubas Carranza, and I'll talk to you about some important questions. First, can different COVID-19 vaccines be used in the same country? Well, the answer is yes, it's possible. In fact, it's very likely that a country will have to use vaccines from different platforms or producers. It's by this reason the PAHO and the WHO has recommended strengthening the vaccination registration systems, since this is the key to controlling the type of vaccines received by each person, and also monitoring when the second dose should be administered. It's also highly recommended that the persons vaccinated keep the vaccination card. Okay? Now, how are the American countries preparing to monitor and potentially address any adverse events attributable to the vaccination and immunization with COVID-19 vaccines? Well, with the support of PAHO, the American countries are working to strengthen and develop surveillance systems to quickly identify and respond to any adverse events attributable to vaccination or immunization. Okay?
Hello, my name is Diego Ordóñez. In this video I will talk a little about the COVID-19 vaccines. How will the vaccination campaign against COVID-19 be coordinated with that of influenza annually? PAHO and WHO recommend that COVID-19 vaccines not be administered with other vaccines, including those against influenza. A minimum period of 14 days must be expected. This recommendation might change when more evidence is available. All countries should maintain their routine vaccination programs during the pandemic, including vaccination against influenza in countries that have introduced it, especially in risk populations. Survey in Honduras on COVID-19 vaccines. Question number 1. Do you think that getting vaccinated against COVID is the right thing to do? 69% say yes, 14% answered no, and 17% did not know. Question number 2. Do you think that vaccination against COVID will protect you against the disease? 47% say yes, 30% don't know, and 22% say no. Question number 3. Do you think that getting vaccinated against COVID-19, you or a family member, prevents a spread in your community? 62% say yes, 21% say no, and 17% don't know.